can we tell the child what they can do? It is far more effective than telling the child what they can't do.
When most people hear the word discipline, they think consequences, punishments, or stopping bad behaviors in the moment. But what if we've been thinking about discipline too narrowly? In this episode, we're reframing discipline in toddlers through a completely different lens, one rooted in connection, development, and emotional regulation. Because toddler misbehavior isn't usually about manipulation or defiance. More often, it's communication. This is Charting Pediatrics. To help us create developmentally appropriate expectations, we are joined by two experts. Dr. Julia Palazzi specializes in child psychology here at Children's Hospital Colorado and is an instructor at the University of Colorado School of Medicine. Allison Hatton is a licensed professional counselor specializing in child counseling as well as infant and early childhood mental health. She's also an assistant professor. Julia and Allison, welcome to the podcast.
Thanks for having us. What a beautiful introduction.
Oh, thank you. It's so good to have you guys here. Why don't we start with toddlers? Because I think, first of all, discipline comes up a lot in that age group. And also parents are often involved a lot at that age because they may or may not be in daycare. Why don't we start by saying what we mean by discipline?
So when I think of the word discipline, I think of teaching. So it is parents, caregivers, important adults in a child's life's opportunity to help guide and teach. So it's like looking for opportunities to help to figure out what kids are like, what's happening in the moment, and then what is it that they need.
Yeah, I would agree with Allison that when we're thinking about what people, you in that introduction are saying, we're trying to reframe discipline. And I would agree with that completely. Can we reframe it to think about when I am seeing my child not being able to meet the behavioral expectations of our family, of this moment, what skill is missing or what connection is missing between my child and I? And so can we start to reframe to say, what is this lack of being able to meet behavioral expectations showing us, telling us?
As I said in the introduction, do you think it is about communication?
Yes, and connection and using the environment around the family to support the needs of the family and behavioral expectations within the family. And having the skills to do it, having the skills of a toddler to be like, I can do this thing.
Yeah, when kids are toddlers, they're like little explorers, right? And so they're often testing limits. So what's a good way for parents to set limits?
So I think of limits, there's kind of different categories. And so when you were saying they're busy and they're active, they're also curious. And so sometimes when we're setting, I actually think there's times where we can redirect or we can set a limit. So sometimes kids are really, really curious, as you can see, like in the exam room, they might be trying to check out like the otoscope and all the things hanging on the wall. And that's just, it might be pure curiosity. Like there's nothing else interesting to play with or do in the room. And so redirecting them to something that's age appropriate, like here's a piece of paper, here's a pen, here's some crayons, here's some stickers, like a book to look at. I think in the toddler years, it's important to be setting limits around things that are safety. So, helping like, and also redirecting, but saying like, no, the outlet is not safe. And I know in the clinic, just because I think we need to be able to access outlets, ironically, they're not always covered. And so that is one of the times that I myself or other providers in the room might be like actively setting limits, just because and it's a good way to also remind families of ways to make sure that toddlers are staying safe in their home. So making sure they have outlet covers and keeping things away.
I think what Allison is also speaking to is how can we use the environment to set limits without even having to set them. And so when we know that our toddler is growing and is going to start being curious about things like outlets, can we use covers to set those limits without us having to say a word? Do we have spaces in our homes, if they're available, to be able to say yes, to have toddlers explore freely, right? How can we use the environment to set those limits for us?
Mm-hmm.
So one thing I hear both of you saying is that distraction is helpful, especially in toddlerhood. You know, if something's not a big deal, maybe you distract them with something else. But then other times, especially focused on possible injury, those are the times when we may need to intervene. Julia, you had said one thing is, you know, we could put some concrete things in place, you know, some barriers so that they can't get themselves into trouble. What about though, when you don't have those things in place and they might be doing something wrong? Is it appropriate to say no? Do you say no strongly? Tell us more about that.
I have feelings about this.
Yes.
Okay. Tell me.
Okay, so this is such a hard skill for parents, but if we can, and you know, medical practitioners can also model this, like you were speaking about earlier, Allison, is can we tell the child what they can do? It is far more effective than telling the child what they can't do. So let's take like the example of we are lucky enough to have Child Life in our primary care practice. In Child Life, they do a really beautiful job of helping kids understand boundaries with the toys. And one thing that you will see them do is, you know, a child is playing with a fidget toy and puts it in their mouth. What we want to say to the child is, we can keep that toy away from our mouth. And that's far more effective because it is telling the child, here's what you can do with that toy, rather than just giving them a no, which they can't necessarily attach to an action, giving their like growing and developing brains. And it gives them the opportunity to be like, okay, I know what I can do, and work to meet that expectation.
And so another example would be like if a child is standing on the exam room table and jumping, they can jump on the floor instead of, so trying to use like in the positive of what they can do versus what they cannot do. So your body really needs to jump right now. You can jump on the floor.
Is this a tactic that is better or we should be using instead of no? In other words, can you still say no?
You can definitely say no.
Okay.
I'm going to encourage providers and parents to practice and work on saying what you can do. And then if the expectation isn't met, so let's go back to that toy in the mouth or the jumping on the exam table is such a great example. Yeah, so let's go back to the jumping on the exam table. So a child is jumping on the exam table. You can either say you can have your feet on the floor or you can sit on your butt on the exam table. Then the child isn't able to follow through with that behavioral expectation. That's when we can use a natural consequence of, okay, we aren't able to follow through, so we're going to come off the table. And that's that natural consequence in place of saying no. And so in that, you've both set a limit and a boundary, and you haven't used the word no once.
And so Julia's mentioning choices. And so choices is something else that can replace kind of this idea of having a hard like consequence or saying no. So like redirection, choices, all of those really are interchangeable, and giving the child what they can do.
And are more effective than a no.
Yes.
But certainly you can use the word no and are going to as a parent and a provider.
And what I usually the message I try to send to parents is if you're using no, it is going to be most effective if you're using it in very limited situations. So if it was like they're running out in the street and you do need to move quickly, you might say, no, there is a real safety concern with that. So, but if you're using no all of the time, it really loses its effectiveness. It loses its meaning. And it's also it's not telling the child what they need to be doing instead.
Yeah, I always find it, lightly humorous that sometimes parents will come in and be like, oh yeah, they say no all the time. And I'm thinking to myself, that's because you're saying no all the time. Anyway, let's pick apart a little bit about what you guys are saying. So you're giving me some strategies, and let's focus on sort of positive reinforcement and negative reinforcement as strategies. I'm hearing from you a lot of positive reinforcement. Are there other ways that we can show positive reinforcement besides what you've already mentioned?
In the spirit of like relationship building and connection, parent-child relationship, I really encourage parents to do a lot of like in the moment, like thumbs up, high five, hugs, like showing that reinforcement in a connection way versus like you get some tangible toy. There are times and places where maybe like a tangible reward can be helpful, but I tend to focus more on kind of the experience piece. So even with older, like even preschoolers or older kids, if they're going to earn something, earning like an experience of getting to like have extra time with a parent versus a like treasure box.
This is really a paradigm shift. I mean, I think what I notice anecdotally in the clinic visits is that parents really do focus on positive and negative reinforcement, you know, and I think tangible things, you know, I think things like hugs are great and all that type of stuff. But the thing that drives me most crazy is food as a positive reinforcement, right? We should definitely touch on negative reinforcement, though, and how we should counsel around that. There are a lot of paradigms that have been used for many, many years, including timeout. And I would love to hear your thoughts on those types of limit setting strategies.
Yeah. I think I have strong feelings about timeouts. And the reason that I have such strong feeling about timeout is that oftentimes we are being punitive or punishing emotional dysregulation. And toddlers experiencing emotional dysregulation is natural, normal, and completely vital to the development of their emotional regulation skills across the lifespan.
Can you tease that out a little bit?
Absolutely. Okay. Yeah. And just to, again, you know, theoretically thinking, I believe that emotional regulation skills, the ability to regulate one's emotions, cope with, understand that they happen, let them happen, emotions, and bounce back from having a big emotion. That is one of the underlying keys to psychological health across the lifespan for anyone. And we are learning that skill most potently in toddlerhood.
Interesting.
So how we respond to emotional regulation in toddlers is can be so transformative to their overall lifelong mental health. And so when we are responding to emotional dysregulation in toddlers with timeout, we're disconnecting from them, right? Now, a difference being if a parent needs a moment to regulate themselves, that's important, right? And that's different than a timeout. A timeout is a punitive disconnection from the child that says you are being disconnected from until you can regulate yourself. And that's not how emotional regulation skills are built. So I'll let Allison kind of take that from there. But that is why I have strong feelings on timeout. Does that make sense?
It does.
Okay.
Yes. It does.
Yes. So I wholeheartedly agree with that. I think that is often the primary reason that I will explain to parents why timeout is not recommended. I also tend to talk about most things from a developmental lens and just what are kids like, what's developmentally appropriate, like what makes sense for where they are developmentally. You know, parents will often say like my child, particularly a toddler, won't stay in one area. Well, yeah, that's not like that. That's consistent with where they are developmentally. I think for many, many generations, I mean, the words timeout have stuck around for a long time, but for many parents, their memory of timeout was this idea that you're supposed to like be separated and think about what you did wrong. And that's just not like that metacognition, the thinking about your thinking is not like developmentally consistent with a toddler. They also need parents to help them co-regulate. So, first and foremost, I will say that I think timeout is not effective because more often than not, it is punishing a child or using it's used when they are expressing like heightened negative emotions. And so it is doing the opposite of what we really want to do, which is help support them through that.
Can I take it back with a little bit
You
of theory
sure
for
can.
our medical providers? So thinking about when a baby is born, they are born with zero regulatory capacities, including being able to regulate biological functions, right? Like they're learning to regulate their temperature, they're learning to regulate everything. And so as babies grow into toddlers, those regulatory capacities are growing larger, but they are growing in connection to the caregiver's regulatory capacities. The caregiver lends the regulatory capacity to the child as they grow. And so it is in sitting with the child, showing the child, I can tolerate your big feelings. You're so upset that you can't have a second cookie. Continuing to hold the boundary firmly and gently and letting those feelings come and showing the child, you can handle these feelings. I can handle these feelings. They're going to come up and they're going to pass. And so we sit and we think about that sitting with the child in that moment as lending them our regulatory capacities as they build their own into, childhood and adulthood.
I think we all probably have the one or two things that drives us crazy, but one of the things that drives me crazy is when boundaries are not enforced, So in other words, the next time you do that, and there's some sort of consequence, but it's never followed through. And then what does the child think? I mean, from an emotional regulation and also just from a cognitive point of view, what kind of message does that send to the child?
Yeah. I mean, if you think of it like using behavior principles, then there's like variable reinforcement. And so you're going to keep, if I'm sure that lots of audience members like took, gen psych or something in college, and you learn about like kind of the basic, like rat experiments where, they're trying to get food and pushing the bar, but it's only going to maintain that behavior if there's not if it's not addressed in a consistent way. And so, I think of it as threats. And I'll often tell parents, like if we're threatening for something to happen and then it doesn't happen, it's not going to be very effective. So I think there's a lot of room for thinking ahead too, like helping parents to like plan ahead. So when this happens, how are you going to react? Because it is hard in like a heated moment to know exactly. Like I think you can feel kind of flustered as a parent if your child's emotionally dysregulated, doing something that might be disruptive in a public place. And to know like how are you going to respond?
Of course.
Yeah.
Can I take that, what Allison just laid out and kind of think about it in a specific way? So, what you're referring to are parents responding and being reactive to a behavior. And Allison, you're making a great suggestion for providers to support parents in planning ahead for a behavior. Earlier, I spoke about natural consequences. And so let me give an example of how that might work and how a provider might be able to think about that with a parent is we'll give a really basic example. Obviously, then we're going to layer in public spaces and things like that. So it gets more complicated. But let's give it a basic example of we tell the child what they can do. You can roll the ball in the house. The child is learning how to play with the ball appropriately in the house. And so inevitably they end up throwing the ball. So the ball is thrown. The parent says, we're still learning to throw or to use the ball appropriately in the house. So the ball is going to go away. We're going to try again tomorrow. So we pull the ball away, right? That's the natural consequence of the ball was not used appropriately. We told them what they can do with the ball. The natural consequence of not being able to meet those expectations is that the ball is taken away, but we give the opportunity to try again. That is the skill building piece. So that natural consequence helps to build that skill of understanding when I don't roll the ball, when I throw the ball, the natural consequence is that I lose my opportunity to use the ball until I get to try again tomorrow. Then we set that boundary, we pull the ball away and we try again tomorrow. Of course, we're trying to do this non-punitively if we can, if we are regulated ourselves as caregivers. And then we potentially have emotional dysregulation, right? Like the child is sad that the ball was taken away, which makes total sense. I get sad when my balls get taken away too. And so we sit with them and we say, you're really sad that the ball is taken away. We're going to try again tomorrow. And we just sit with those feelings with them. Is that good practical application?
It's great practical
Yeah.
application. And I was going to ask you anyway about the emotional dysregulation, but I'm hearing you say it anyway. And that is that you can verbalize and process out loud with your child so that they start understanding that these are feelings. It's normal to have angry feelings. It's normal to have sad feelings, that they will pass. And it really, really resonates with me what you said about this being an opportunity early in life to set a person up for a lifelong of having a little bit better balance in how they deal with their emotions in a lifelong skill. Go ahead, Allison.
I was going to say, toddlers are also looking to their caregivers and the important people around them for how those people manage emotions.
Yep.
So I think one of the biggest tasks, and I tell parents this, is actually like really practicing how we manage our emotions in the midst of these new humans that we've brought into the world. Mm-hmm. And oftentimes it is harder to hear your own child be really dysregulated than maybe, the neighbor or a kid in the grocery store.
I think we would be remiss not to talk about spanking, albeit briefly. I know a lot of parents believe in it because their parents did it to them, and then it just kind of gets handed down generation to generation. But what's your advice around spanking?
I think that one thing that is worth touching on that is more nuanced, so we might not be able to flesh it out all the way, is you're bringing up this really important point about parenting, is that it is handed down from generation to generation. And parenting is built on the relational health of the family system. So when I say that, I mean, how healthy are the relationships within a family system? And that's passed down from generation to generation. So I think that providers probably see this, but they probably see parents being really strong in their feelings around how they parent and the tactics that they use. And when we have spanking as part of a family's history and it is continuing into this generation, it is oftentimes because those family systems have values that are very, very tightly held and have been passed down for generations. And so the longer answer to this that I would encourage providers to consider is that when we are seeing a behavior such as spanking, we need to really be relying on the trust between the provider and the family in order to gain traction in changing that behavior, because it is very ingrained within a family system and likely has been far more severe in generations that have come before this current family that we're seeing in our exam room. And so I really want providers to think about the trust that I have with this family, managing their own emotions when you hear a child is being spanked, because that's going to bring up emotions for us, right? And using as many good reflective skills as you can. I hear you saying that you feel like it works. I hear you saying that it stops the behavior, so that the parents feel, okay, they are hearing me, which allows them to be open to like one key piece of information on how spanking isn't effective. But we really are going to get one line to support in changing a very likely very ingrained behavior within a family system. And so I'll turn it to Allison to think about like, what is that one piece of information we might want to provide on why it's not effective, but that the trust between provider and family is going to come first and foremost in that conversation.
Yeah. Thank you, Julia. Well, and I would say how parents parent, discipline, teach, what they think, even how they view their role as a parent, is deeply rooted in how they were parented and how their parents were parented, and changing the generational.
It's big work.
Big work. So I think depending on clinic and clinic resources, you might have like more time and other roles within your clinic that can assist with that if and when needed. But I think at the most basic level, spanking is not effective because it is communicating to the young child that when something is frustrating, when a parent is upset, that hitting is okay. So it ultimately like validates hitting, and kind of a like painful punishment. It is not, because of other things we've talked about earlier, it is not telling them what they could have done instead. It's not validating the child's emotion in that moment, because likely there's emotion that's underneath every behavior.
Yeah.
And so
ultimately it denigrates the parent-child connection. And that's what we prize most importantly in supporting children's physical and psychological health.
And depending on how often it's happening, it also can make that caregiver both the supporter and safe person, as well as this scary, unsafe person. So it leads to, it works against a secure attachment, parent-child attachment.
So what about, you've given a patient parent advice, they do their best and they're doing a great job at home, but the kid goes to a childcare, or maybe for older kids, they go to school and they come home with some habits that maybe they've learned from some other friends, like hitting, like biting, and those types of things. How do you approach that with the families?
So one of the things that I would first be thinking about is supporting the parent in feeling empowered to advocate for their child at school, and potentially connecting to resources. Like in Colorado, we have early childhood and infant mental health consultants that will support the school in supporting the child's psychological wellness. So in Colorado, we have some really robust resources that are directly applicable to a problem like that. So supporting the parent in advocating and maybe accessing resources that would be appropriate related to environments outside of the home would be one of my first thoughts.
Yeah. So going back to kind of using a developmental lens, I think that seeing if your own child is in a group setting, one hypothesis is that they have seen and learned this behavior from somebody else. Another is thinking about their own unique development. So if they're hitting or biting in times where they might be frustrated, how is their communication? How are other areas developing for them? Because, hitting and biting in toddlerhood can be pretty typical. We tend to see it, earlier toddlerhood, so 18 months. It can be a way to get attention. It can be a way to communicate that, I don't like what's happening. I'm frustrated. I'm mad. But when children don't have as much verbal communication or a way to communicate themselves. When we do see when kids have communication delays, that it often can be associated with using more hitting and biting, kicking. So I think wanting to maybe step back with the parent and think about there are multiple kind of hypotheses, and obviously in the room you would know what you're seeing, how the kid is developing, but considering that. So yes, some things can be learned. Others advocating and finding out how limits are being set in the actual group care setting.
Another strategy that I would think about, because we are focused on toddlers, is I don't think there's going to be any primary care provider that isn't going to be asked, how do I respond to my toddler hitting and biting, right? It is basically synonymous with early toddlerhood, as it is a way of communication when we can't verbalize, hey, I don't like that you took that toy from me. And so really the focus there can be what I call body safe language. And so the caregiver can start to learn and use body safe language as they intervene on hitting and biting, things like stepping in between, let's say, sibling discord where a bite has just happened. And the parent says, it's my job to keep your sister's body safe. And that's a way of helping children know what the expectations are, kind of going back to strategies that we talked about earlier. The expectation is that we keep our body safe, we keep our sister's body safe. And so starting to think about what is language that we can use that models the safety needs and expectation of the family in response to hitting and biting. And we just hold that, that boundary gently but firmly.
You've given us such tangible tenets and strategies for, discipline limited setting in kids. Have there been any family dynamics situations or children that have challenged these tenets for you in your career that you've really had to, or is it more about consistency and really follow through with the families actually doing the things that you're recommending being done?
I think that as much as we love teaching skills, and there is so much value in teaching skills, oftentimes parents and caregivers have a hard time responding to a skill because they either need space to practice it, or there is what we call a ghost underneath the, what I'll call deficit, but that's not strength-based language.
What's a ghost?
So when we see that a parent can't follow through on a skill, or can't follow through even though they understand developmentally appropriate expectations for a child, we can know that there is a wound, or what we call a ghost, from their childhood, the way that they were raised, that is haunting the way that they are able to parent their children. And that is oftentimes a much larger journey to go on to uncover and notice and acknowledge. But I would say to medical providers that it is in the unconditional care that we provide our families, in the respect, in the way that we show them that they are dignified and cared about by us, that we support the healing of ghosts. And this is across care providers, right? Not just medical providers, but it is in the way that we show up for our patients that we can support the healing of those ghosts, along with skill providing too.
Do you use that word ghost with the family?
Oh, yeah.
You do?
Yep. More in my long-term cases. So, do you get do you have a long-term relationship with a family where you're able to introduce this idea? And most of the time, parents respond to it and they're like, oh my gosh, you're right. That does feel like it is haunting me, because I have never met a parent who doesn't want to do right by their children. Even, I want to share this story. So back to the corporal punishment, a family where I was working with the mom for short-term behavioral health services, which we're lucky enough to be able to provide in our clinic. And mom was spanking. And one of the things that she shared with me is that with her child being a Black boy, that she wanted to make sure that he was prepared, that the world was not going to be kind to him. And so that's not just a skill where you're like, hey, can you stop spanking because it denigrates the parent-child relationship, right? That is a deep-seated, real fear of hers that her child will grow up and not be safe. And so there's so much more to explore underneath that. But it is in safe relationships that parents can gain the courage to explore those things.
That's a really powerful story. This has been a great conversation. I wish we could talk for longer, but we are out of time. I'm just thinking, we've talked about so many things. If you guys had like 1, 2, or 3 things that you would want our listeners to remember from our conversations, what would they be?
That you have an extremely powerful role as a primary care provider for children and families in helping parents to see how worthy and lovable and amazing their kids are. So with the continuity of care, like you hold that you can hold with them like all of the things that they've been through and celebrate. And so I think no matter like really the family or the child, I mean, some children are more difficult to parent. And some have just some unique differences, but to help.
Some kids have ADHD.
Yes.
They're impulsive, right?
Yes. Yeah. Some kids are even harder to use all of these tenets with, but, they can feel like a conundrum, but we still can find ways to celebrate successes. I think modeling. So when you notice in the room that something might be a bit different, using yourself to be able to demonstrate that, and encouraging the parents to give it a try. So when I do this myself in the room, I do always want to be careful to not be making it seem that I can manage their child's behavior better than they can, because that does not feel good as a parent, for your own confidence and capability. So, but I think if I notice a child's curious and that what looks like misbehavior is really kind of typical toddler behavior that needs to be redirected into an activity while, pediatrician and parent are, talking, and kids like, what, there's nothing to do. This is a boring place, that we can really model, like, let me run out. I'm going to get something to do. Of course, there's like not much to do. Earlier, Julia had mentioned like kind of yeses, or like I talk about often in the exam room specifically that I'm like, there's not a lot of yeses in here. There are not a lot of like, this is not a yes environment, which could be a whole other topic of creating yes exam rooms. But there's a lot of no's in here. So let's bring some yeses in, kind of modifying the environment for who we have in the room. Yeah.
How about you, Julia?
Okay, I'm going to share two things, one more broad and one more specific. Broadly, I think to build on what Allison is already saying, I really want medical providers to know that the power to uplift caregiver strengths is within the safety and the trusting nature of the relationship that you're providing. And I get the pleasure of working with our providers at CHC. And so I see those relationships unfold every single day. And so thinking a little bit about how do I continue to show up for those trusting relationships with my families over the course of time, which is another beautiful thing about primary care, is that we do get to show up for families over the course of time. But the power is within that relationship. Uplifting the strengths that a parent brings to the relationship with their child is parallel to the relationship we provide the caregiver. So that's my broad takeaway. My more specific takeaway is pediatric primary care providers, I want to rebrand tantrums so badly. Can we stop using the word tantrums? Can we start using language like emotional dysregulations, heightened emotions, and start talking about that over the course of a day, everybody goes through lots of different emotions. Your toddler is maybe going to throw themselves to the floor when they're feeling big emotions because they're toddlers. And the way that we support them in being able to not throw themselves to the floor as adults is by lending the regulatory capacities of the caregiver. And so can we start talking about emotional dysregulation as natural, normal, and actually a vital developmental moment where we can support lifelong skills and lifelong wellness. So that's my two takeaways.
Oh, and I'd like to add supporting the caregivers so they do have the regulatory capacity to offer.
Yes.
Love that. Yes. Thank you both. Thank you for all you do, and thank you for being here.
Thank you, Dr. Dan.
Yeah, thanks for having us.